this is the thing that separates, I suppose, really experienced clinicians who can really help people with everyone else. And that's the right exercise at the right load, at the right angle, for the right amount of reps, for the right frequency.
Yeah.
Because a lot of people can say, okay, they need a stronger quad for their knee extension, or it's a rotator cuff related pain, or it's, whatever for my lower back or my glute. It's very, I think not 9 out of 10 physios will find the right problem, but they won't often find that right solution, which is they might start them on something too difficult or too easy, or I suppose we might, let's say for an Achilles, if my granny can do 10 calf raises, that might be enough for, okay, but for the athlete who wants to run a marathon, maybe it's not enough for them. So having that context of what's good enough for this person, or what can the other side do? And, even the person coming into you can say, well, I think it's my rotator cuff, restart. And you'll go, well, I agree with you, but what you're doing in the gym is way too hard or way too easy, or it doesn't correlate to actually where I find your weakness, find your pain. So, it's actually, it's the experience you have seeing thousands of shoulders that allows you to really accurately and really quickly get to that right solution.
Yeah, and I think it's, we don't want to overcomplicate the idea, because sometimes it's extremely simple. Sometimes it's a very basic movement, a very, very basic exercise. And sometimes it isn't. Sometimes we should be very precise. We should be very particular about the way we do things. And again, as you said, Mike, it's that experience. And I think what as physios and strength and conditioning coaches, which we are exercise experts. And the really, as you said there, I think that really sets clinicians apart is that ability to find the right entry point.
Yeah.
To be able to maybe progress or regress the exercise appropriately. And to be honest with you, I think we'll probably all agree that like what most people will do is come in too hot, come in too hard, and I think, maybe what we do is sometimes we might fall into a sense of, oh, this is what I did before, so it worked, but we have to apply it to the individual, and we have to be flexible in the way we prescribe exercise. And again, quite often it is simple, but sometimes we have to be really particular about the position, the angle, the load, the speed. And small, subtle changes there can make all the difference, where, suddenly that feels much better now. And that's the coaching side of things. It's the cueing side of things. And I think we have to be really switched on in that early phase to create buy-in, because there is a bit of jeopardy there. If we come in, way outside what's going to work here, how many times can we do that before we begin to lose the trust and the relationship at the beginning? So it is really about finding that right level and building trust with our client.
Yeah, and again, on the initiation, like as you said, somebody might have said, well, I tried 3 rotator cuff exercises and my shoulder was killing me for a week. And then they almost go the opposite way. They flip and then they do nothing. And I did nothing for 3 weeks and it's still sore. Yeah. So they either go in way too hot, or they do absolutely nothing.
Yeah.
They rest it, they lie down, I'll take a break for a month. And there can be a little bit of fear when we're starting something. It's like, I'm not booking in with your wrist guard because this shoulder feels great.
Yeah.
I'm booking in with you because this is actually really sore and it's really affecting me. And now I can't sleep and I'm struggling to put things overhead at home. So, there can be a little bit of fear about starting something new, especially something that sounds like the thing that actually annoyed me in the past. But when you get that right level, it's up from rest and they feel better. That, it's a huge buy-in, it's a huge relief.
Yeah.
They're worried, geez, do I need more MRIs? Do I need a surgery here?
Yeah.
Is this the same bad shoulder that my uncle had and then he couldn't work? So the second they see that, suppose that positive change, it can be like, oh, phew, thank God, I only have 2 shoulders. Richard's seen 1,000, he can really help me here.
Yeah.
And even on the mechanisms, it's like, the second my brain starts working that area and sending the signal, and I get some of that motor unit recruitment, some of that activation, geez, my strength has improved loads in 30 seconds. It can happen quick. And even from, my heart is now pumping blood to that area. Any recovery or any tissue damage might get a bit better with more blood supply and more oxygen to the area. So, if we can get that motor unit recruitment, we can get that heart pumping, we can get that person's fear to die down, we can re-emphasize our diagnosis. Like, not only have we initiated the rehab, maybe we've reinitiated, that spark of, I can get better. There is maybe a light at the end of the tunnel.
Brilliant, Mike. And look, you're touching on this idea of it's how we package the exercise. It's not just try this. It's we're doing this because, why are we doing this? Why do I think this is going to work? And there needs to be a logic there that we can, a strong logic based on our assessment. That we're not choosing exercise. We're not giving this a go because it might help. We're doing it because this is exactly what you need. This is why you need it. And then the next thing is, this is how we start. This is the first step. And then the next thing that's really important is explaining, this is where you need to go. And, I can just think of so many examples where you might see someone who, just take shoulder, for example. I tend to see quite a few who have maybe had an issue that's there for quite a long time. And maybe they've seen physio before, and they've also tried exercise before, and it didn't help. And I'm there saying to them, well, listen, what you need to do is you need to rehabilitate the shoulder with exercise is a big part of what you need to do. So it's really important that we need to get the details of that right. So we're going to do it differently. We're going to explain exactly why you need to do it. We're going to explain exactly how to do it. We're going to talk about the details of what you should feel, how do you know it's going wrong? What changes do you make if you're not feeling right? How do you know that it feels right? Where should you feel it? And what are the goals? And all of that kind of packaging around it, I think, is massively important, because it creates meaning behind what we're doing. And it's not about 10 exercises. Like, I like to give 2 or 3 exercises if I can. I think when things are going well, you've picked a really important couple of things that are going to move the needle, that are really going to help. And especially in that early phase, if we can get that going, we move a little bit away from pain, a bit closer towards our goals. We're setting the foundation then for our next phase. So this initiation phase we're talking about here is just so important. It's really important, for builds on on what's going to come. And we're doing things like building strength in the muscles that have been injured, building motor control, trying to break down any maybe compensatory patterns that people have developed. And all of these things are really important for what we're going to do later on, which is some of the heavier loading and the more sport specific or real world related movements. And so this phase can sometimes, seem a little tedious or seem a little bit maybe even boring, because the exercises are a little bit more precise and they're a little bit lower intensity. But when we package it correctly and we explain why we're doing this and explain the logic behind it and how it's a stepping stone for the next level.
You're laying those foundations. So, you want to build a house, you appreciate that half the time is spent getting the groundwork right so that the thing can shoot up. And, that's what you do in your rehab.
Yeah.
But again, brilliant, right? Everything you said there, I'm like, great, I want to book in with you now for my shoulder. We're getting the plan and the diagnosis and all this, but how do you make it really easy for the patient not to go wrong? Okay, they've been to a physio in the past, they've tried exercise in the past, something's gone wrong. Like what? Like I leave here. You've just done my appointment. I leave here. Like how do you make it fail proof for me?
Yeah. Well, again, I think this is where the kind of partnership piece comes in. So first of all, I think I asked the questions. Do you think you can do this exercise? Do you think this exercise is going to work? Do you understand why you're doing it? And if I'm getting yes, I really like this, I'm looking forward to doing this, then I've got a high confidence. Whereas if there's a little bit of, I'm actually not sure this one feels right, or I don't have confidence doing it, well, we might review it, modify it, change it. And then, of course, what we do with every client with every exercise is we will video record it, and I will narrate the video recording. So I will show the patient the exercise, I will get them to do it, and then I will narrate the video. I will record a video of them doing it and narrate them doing it, and make sure that we say all the key coaching points, and maybe give here's how to modify it, here's how to change it if needed. So there's a bit of, again, this is the idea of packaging the exercise, So and then we put this into a program, of course, where we explain exactly how often am I doing it. We call this the recipe, So we've got our exercises are our ingredients, but it's hard to bake a cake with just the ingredients. We need to know how much of each ingredient do I put in. So at what level do I have to weigh my flour before I put it in. Okay, I don't want to put all the sugar in at the end. Okay, so what I need to do is I need to pick.
I've done that before.
The right amount of the right exercise at the right time. And there's usually 3 things I want my clients to know about these initial exercises. You need to know what to do it. You need to know what to do. Okay, so how exactly to do the exercise, and that's really important. And the videos really help with that, and the coaching helps with that. You need to know when to do it. So are we going to do this twice a day, or are we going to do this every second day? And that's really important, because we don't want to underload or overload. And the third thing you need to know is, how do I progress this? So there's no point in doing exercise. I'm not just doing something, I'm trying to get better at it. That's the whole point. So if we have those 3 things right, I think that equals a high level of confidence for clients, and brilliant, and generally works well.
Yeah, and I love to give people as well maybe a range of things. So I can say, on this exercise, do between 10 and 20 reps. And what I'm not saying is 20 is better than 10. What I'm actually saying here is, we don't know how you'll respond at the start, because this is new. So let's dip our toe in the water and see how you feel for the next 24 hours. Let's not dive in head first.
Yeah.
If we all know this is a calf issue, but I'm probably not going to get you to go skipping for an hour straight away, because that would just be diving in at the deep end.
Yeah.
So when you give someone a range and you tell them, right, let's start at this smaller part, But as the week or the 2 weeks, 3 weeks, whatever it is go on, I want you to go up and up and up and up and up. As long as you're feeling good, not having any exacerbation, it's not causing a flare up, you're getting more confident. And then they're coming back, and it probably ties us into, later on, but they're starting to accumulate a little bit more, maybe tolerance to this exercise. They're starting to hopefully see an improvement day to day. They're coming back better. So they're not just on this one sort of linear line. They're actually getting better as they come on. And by the time you see them, then they're ready for the next step.
Yeah, spot on. And, quite often, like, again, it's not maybe always the case that we're looking to 100% avoid all pain, but in general, we want the exercise to be pain-free and feel tiring. If you feel good doing it, you feel tired doing it, and, maybe you have some fatigue the next day, but you don't have a big increase in your pain, that's probably a good sense that we're in the right place here. And then, okay, let's try repeat that and then start progressing it. And that's kind of practically what we're aiming for, is ideally pain-free, ideally tiring, and ideally I can do more of it, gradually.
Yeah. And as you said, they have their plan, they know their expectations. So, something I might say is you're not going to get better twice as quick by doing twice as much. Okay, if anything, that'll make you worse.
Yeah.
So, I don't want you doing this 10 times a day. I don't want you doing it morning, noon and night. I want you sticking to every second day or twice a day, whatever it is. So again, once they're crystal clear on that plan, and I think giving them the example of how this will go wrong. This will go wrong if you don't stop running like I've asked, or if you do way too much. And then they go, oh yeah, phew, I won't do that, because we've all done it. We've all done it ourselves.
Yep.
The 1st of January, I run a 5K every day, and I'm sore by the first weekend. So
yeah.
That happens.
I think, Mike, it's really important to explain that, because, of course, when we experience the exercises improving me, well, then there's a kind of a natural logic there. Well, let's do more of it. And a really important sentence I try to always say is, it's not the more you do, the better you get. Okay, there is a Goldilocks zone here. Okay, not too little, not too much, and that's what we need to try and find. And we've all been caught by doing too much, and there's a double-edged sword there where we need to try and find that right level. Okay, and I think that's really important, and explaining that to patients is important, because people do get a bit carried away sometimes and decide, right, we're going to go, this is making me feel better, let's do it 2 or 3 times a day, and then later in the week we're starting to feel sore, and then so it's controlling all of those expectations and setting out a really clear plan. Yeah.
And it can build up, and it's like, it can be the rate, right? So it's like, I've gone from doing nothing, I'm absolutely buzzing because I'm leaving here and Richard's given me a plan, and I up it for 5 days in a row. And now actually by the following Monday, I'm doing so much more than I was on the previous Monday. And that rate of change is just so high and so sharp that they go, oh no, I broke down after 5 days. So then building in our rest day, or maybe forcing them to have maybe a slower rate of sort of accumulation or of progression, as opposed to a really steep rate. Yes. And again, that can be new information to someone, because like that, they'll say the first four days were brilliant. So I kept upping it and kept upping it and kept upping it. And I say, like, well, if you just tried to run to Donegal, at some point you'd break down. So, at some point it's too much.
Yeah.
So we're trying to find that zone of safety, that Goldilocks zone.
Brilliant, Mike. And again, it's another really important thing, I think, always to explain early on, is that it's the importance of recovery and it's the importance of rest. So, and I think this crystallizes it, which is that exercise does not make you fit. It makes you tired first.
Yeah.
Okay. So, after your exercise, are you fit and strong now? No, you're now tired and you've fatigued the tissue. So now what you need to do is you need to recover first, and then you will get fitter and stronger. And it's really important. So, because again, people do miss this, I think, sometimes, which is, I'm just going to go and do more and more and more. And, sometimes that actually can be the root of the problem, which is that, I'm doing a lot, but actually I'm doing too much. So exercise, again, it's tongue in cheek, but exercise doesn't make me fit first. It makes me tired, and then I become fit when I recover from it. And I think that's a really important sort of way of putting it to our clients.
Yeah, and it just reminds me, again, someone on Monday, and we might even bring up the kind of the graph of super compensation. Okay, which it's actually our theory of, if I actually do 1,000 squats, what I do is I get weaker, I get more tired, I get more fatigued, I cause damage, and my body sends a signal there. It's looking for equilibrium, and it says, hang on, let's build this back. And what it does is it overshoots. It builds it back better than it was before. And if I can hit my next session when I'm stronger, and I can repeat that over time, the theory is I will get better. Whereas if I'm tired and I haven't quite got back or got above baseline, I hit my next session and I do that over time, I'm going down. And I had someone in during the week who's probably more into, say, bodybuilding style workout, like really big, strong man, but hammering the gym 6 days a week, and 4 or 5 of those days doing lots of upper body work, coming into me with a little bit of an overuse rotator cuff problem, kind of neck pain and stiffness, went on holidays for a week and did nothing and felt great. And, on my diagnosis, on my initiation, yes, I can do a neck exercise. Yes, I can do a rotator cuff exercise. But this man is going to be back to me again and again and again and again and again if we can't tackle the root problem here, which is that the load is really, really, really high. The recovery is a little bit poor, and this can't be outworked. Or, what somebody like this wants is give me more to make this better. And really what they need to do is a little bit less. And when we went into and this is, I suppose our unique skills as S&C coaches, as much as physios, is, well, show me your upper body workout. And suddenly now there's 8, 10, 12 upper body exercises per day. They're all extremely high volume. They're all extremely high loads. That was a recipe for this overuse type pain. And, we can't quite outwork it.
100%. No, really, really good.